Depression. Depression is more common in middle-aged females. Middle-aged females mean around 40 years. Okay. Depression, the word commonly used word depression, actually in psychiatry it is major depressive disorder. Major depressive disorder. Nothing major about it, but we say major depressive disorder or unipolar depression. So three names for the same thing. You must remember: major depressive disorder, unipolar depression, or depression. Mnemonic for this is EMI gaps cause depression. To remember the symptom: E for energy, low energy, decreased energy, lethargy, low mood, sadness of mood. E for energy, M for mood, I for interest, decreased interest. Sometimes you will find anhedonia. I told you anhedonia is also present in schizophrenia, simple schizophrenia or negative symptom of schizophrenia, not getting interest in previously pleasurable activity, not getting pleasure in previously pleasurable activity, that is anhedonia. EMI. G for guilt, appetite usually decreased. P for psychomotor activity usually decreased. Sleep usually decreased. There is early morning awakening. Early morning awakening. Means normally if patient wake up at 7 a.m., now patient will wake up at 5 a.m., 2 hours prior to the normal awakening time. Suicidal ideation, decreased concentration. So there would be forgetfulness. Forgetfulness. According to DSM-5, if out of these total 5 symptoms should be there, total 5, and out of 5, 1 plus 4, 1 should be either mood or interest. So MI, these are 1 this, and out of remaining 4, total 5 symptoms should be there to make the diagnosis of depression, and duration criteria is 2 weeks, or you can say 14 days. So if these symptoms are present for 2 weeks, 14 days, yes, 5 symptoms, diagnosis is depression. I will discuss ICD later. For the time being, just remember DSM-5 symptom. Any question, they will give clinical scenario. You will count 5 symptoms. You will make the diagnosis of depression. Duration should be 2 weeks. If a patient came to you and this patient is having depression, we represent depression like this. This is a life chart. If we express means, or we represent depression like this. This is depressive episode. You gave treatment, patient is treated. Now after 2 months, 3 months, minimum 2 months, 3 months, 4 months, 1 year, 2 years, he developed depression again. Then you will say second episode of depression, and better to say the diagnosis is recurrent depressive disorder, means more than 1 episode of depression. So if more than 1 episode of depression, recurrent depressive disorder, and you took history properly and you found that every time this depression occur in a particular season, just like winters, means in a season. So that's why we say seasonal affective disorder. Yes, remember this point. If in a particular season, seasonal affective disorder, it is a type of recurrent depressive disorder in particular season due to change in the circadian rhythm. Yes, but remember, they will try to confuse you that a patient develop depression every time in winters because there is loss of job in winters. In winters, his Factory is closed due to loss of job. Every time he developed depression in winters, then it is not seasonal affective disorder. This is recurrent depressive disorder. If depression, cause of depression is season, circadian rhythm, lack of sunlight, then it is seasonal affective disorder. And the treatment for seasonal affective disorder is bright light therapy. Bright light therapy. Clear? Now, in this patient, recurrent depressive disorder, seasonal affective disorder, depression criteria, you know, if this patient having 5 symptoms for 2 weeks plus delusion. Delusion, I told you, delusion and hallucination are psychotic symptom. Psychotic symptoms. Delusion, hallucination are psychotic symptom. So depression criteria is fulfilled. Also having hallucination, delusion, psychotic symptom is there. You will say depression with psychotic feature or psychotic depression. Depression with psychotic feature or psychotic depression. Clear? Got the point? Now, persistent mood disorder. Suppose there is a person who is having depressive symptoms. I symbolize depressive symptoms like this. Depressive symptoms are there. Suppose 2 symptoms are there, 3 symptoms are there, means depression criteria not fulfilled. I told you DSM-5 total how many symptoms should be there? 5. In this patient, depression criteria not fulfilled. Patient is having these symptoms continuously for 2 years. 2 years. Then you will say dysthymia. Dysthymia means depressive symptoms are there but not fulfilling the criteria of depression, and these symptoms for 2 years long duration, dysthymia. Another name is persistent depressive disorder. New name. But even now they ask question on dysthymia. Chronic major depression. Suppose, yes, don't be in hurry, just listen carefully. If a patient came to me having depressive symptom, criteria of depression fulfilled. Criteria of depression fulfilled. Yes, for 2 weeks. What is the diagnosis? Think about it. Yes, it is a major depressive disorder or depression or unipolar depression. I told you same thing I have discussed, nothing different, just represented in the form of this life chart. Now, this patient who fulfilled the criteria now continue these symptoms for 2 years. 2 years. Now the diagnosis would become chronic major depression, means depressive criteria are fulfilled for 2 years. Depressive criteria not fulfilled, 2 years dysthymia. Depressive criteria fulfilled, 2 years chronic major depression. Now I take one more example, one more question. There is a patient who is having depressive symptom not fulfilling the criteria. Depressive symptom not fulfilling criteria for 2 years. Diagnosis is, yes, I have already discussed dysthymia. Diagnostics, depressive symptom, diagnostic criteria not fulfilled for 2 years. This is dysthymia. Till now, this is dysthymia. But this patient later on in later part of life now develop few more symptoms. Now depressive criteria fulfilled. Depressive criteria fulfilled. Now you will say depression. But You have already made the diagnosis of dysthymia. So you will say depression in dysthymic patient. You will say depression in dysthymic patient. Means double depression. Double depression. So double depression means depression in dysthymic patient. So it is clear to you. Now I will jump the topic. Usually adjustment disorder we discuss separately, but I will discuss at the same time. Why? Listen carefully. Suppose there is a person after subjective stressor. What are subjective stressor? Just like financial problem, relationship problem, medical illness, they are considered subjective stressor. Means response depends on the subject. After divorce, a lady is very sad. Another lady may be happy. Yes, I got rid of that bad person. I wanted to divorce this person, but he divorced me. He is saved. I am saved. I planned everything to kill him today, but he's divorced me. He is saved. Means depend on the subject. Although this is really exaggerated pattern to tell you like this, but divorce, different person will consider divorce as different stressor. Financial problem, medical problem. Yes, many person react differently. Subjective stressor. After stressor, you found that patient sometimes is not able to adjust that stressor. Then it is called adjustment disorder. It start within 1 month of stressor and ends up to 6 months after stressor is gone. So stress start within 1 month of stressor. Okay, now I give example. A 29-year-old lady was divorced by her husband. After that she remains sad. One symptom, sadness, unable to sleep. Second symptom, sleep, don't take food. Third symptom, appetite. Yes, 3 symptoms of depression after divorce. Diagnostic criteria of depression not fulfilled.